In this video I'm going to talk about sickle cell disease. And sickle cell disease is basically when the hemoglobin molecules the normal ones are replaced by mutant forms. In a normal person you will have hemoglobin A, which is the normal form of hemoglobin. In sickle cell you have a form called hemoglobin S. And you really need to have 2 copies of this hemoglobin S for this disease to manifest itself. It's basically a mutant form of hemoglobin. And hemoglobin, of course, is the molecule that sits inside the red blood cell. And the red blood cell, also abbreviated as RBC, is at the heart of this disease. And it's best illustrated with a diagram. So here's a nice diagram of normal-looking red blood cells. And you can see they're round and kind of look like a donut. They are able to flow freely through the blood vessels to various parts of the body, and this one shows a cross-section where one red blood cell has been cut in half, and inside are the tiny little hemoglobin molecules. Now these red blood cells travel through the blood vessels to provide oxygen to various parts of your body, various tissues. Now oxygen is what sits inside the hemoglobin. So that's the sort of order of events. You've got the red blood cell, and inside the red blood cell you have a hemoglobin molecule, and then on each hemoglobin molecule are 4 oxygen molecules. Okay, so when the red blood cells look like this, everything is fine. But in sickle cell anemia, what happens is the mutant hemoglobin, HbS, what it does is it causes these red blood cells to have a sickle shape, and that's illustrated here in this diagram, and you can notice how the shape is different. Now what that shape does is that it makes it so that the red blood cells can't flow freely if they were normal shaped. So this causes a blockage of blood flow. And if the blood is not flowing properly through these vessels to the tissues, you get ischemia, which by definition is a poor blood flow. And if the blood is completely blocked from reaching the tissues, you get infarction, which is a complete blockage of blood flow to the area, and the tissues eventually die because they're not getting the oxygen that the hemoglobin normally delivers. So that's a fundamental definition of what's going on in sickle cell anemia. So it's important to understand the pathophysiology. So here's a nice blood vessel, and let's just say this is the end organ that it's supplying blood to. In a normal case, the red blood cells would be nice and round, and they would be able to flow to the tissue and provide the oxygen that sits inside the hemoglobin molecule. But in sickle cell anemia, you've got a mutant hemoglobin, and that causes these red blood cells to now be sort of sickle shaped, and that can cause a poor blood flow, poor circulation, because they clump up and they stick to the sides of the blood vessel, and that poor circulation can lead to ischemia, which is poor blood flow, and then eventually, if the blood flow is completely blocked, infarction. Okay, so that's a very fundamental thing to understand. So now let's move on to the signs and symptoms. So if someone has sickle cell disease, what kind of symptoms will they present with? Well, as I always say, instead of memorizing all the symptoms, let's just try to understand what's actually happening. If the tissues are not receiving the proper blood flow, you'll have ischemia, and eventually you'll have infarction. And what this does, these are not symptoms, by the way, this is part of the pathophysiology, but what this does is it leads to pain. And in particular, it's called painful crises of sickle cell. And this is a very common presenting symptom that sickle cell patients have. Other things that can happen is you can develop splenomegaly, which is enlargement of the spleen. The spleen is essentially overwhelmed by these sickle-shaped red blood cells, and that can eventually cause the spleen to enlarge. Another thing that can happen because of the poor blood flow is that you can detect it on a heart exam. You'll have a cardiac murmur. But what's really important is this one right here, painful crisis. And you might say, well, what part of the body is the person going to be experiencing the pain in? Most commonly in sickle cell, it's the long bones, and it can also present with pain in the joints. So how do you diagnose this? Well, there's two basic tests. There's the peripheral smear. Peripheral smear is basically just a smear, sort of an image of the red blood cells, and on that smear you'll see the sickle-shaped red blood cells. But a more specific test is a hemoglobin electrophoresis. And what this test does is it detects the abnormal hemoglobin that people have in sickle cell disease. So then how do you treat it? Well, the pain is really treated with analgesics, oftentimes very strong analgesics. Morphine and other opioids are used. Another mainstay of managing a painful crisis is hydration, because sickle cell can lead to dehydration because of the sickling. So the hydration of a patient is very important. Now, another part of the treatment of sickle cell is antibiotics. Because when somebody has sickle cell anemia, basically their spleen will have reduced function. And because the sickle cell red blood cells are accumulating in the spleen, and the spleen will no longer be able to clear those like it used to with the normal red blood cells. So you get something called functional asplenia. And what that means is that asplenia, by definition, means the patient doesn't have a spleen. These patients do have a spleen, but the spleen is not functioning properly. So that's why it's called functional asplenia. Now, if a person's spleen is not functioning properly, it makes them susceptible to infection with certain encapsulated bacteria. So that's why antibiotics are key as part of the treatment and management of sickle cell. Which bacteria? It's important to mention: pneumococcal infections, and also salmonella infections. And then the other part of sickle cell treatment and management sometimes can include transfusions, because sickle cell disease leads to anemia because the red blood cells are sickle shaped, and as they travel through the circulation, the trauma can lead to the destruction of these red blood cells, so that leads to an anemia. And oftentimes the hemoglobin count can be less than 5. So when that happens, you have to give a transfusion. And then finally, there's one very important medication I wanted to mention. It's hydroxyurea. And this is important because this is given to sickle cell patients because it's shown that this can actually decrease the pain in painful crises. It can actually reduce the sickling of the red blood cells. And it's therefore part of the mainstay of treatment for somebody with sickle cell disease. So I just want to touch on some of the key points. Key points of sickle cell is you've got hemoglobin S, which is you can think of as sort of like a mutant form of the normal hemoglobin, which is hemoglobin A. And this causes the red blood cells that the hemoglobin sits inside to become sickle-shaped instead of the round shape. These sickle-shaped red blood cells can't travel through the blood vessels to the organs properly, and that leads to ischemia and infarction of the tissue of those organs, and that can lead to pain, functional asplenia, and infection. You diagnose it by doing a peripheral smear or hemoglobin electrophoresis. And then treatment involves pain medications such as opioids, antibiotics to treat the infection, sometimes transfusions, and aggressive hydration. So now I have a clinical vignette here. I'll go through this. 2-year-old girl with sickle cell disease is brought to the emergency department because of a one-day history of fevers. She is generally healthy and has not had any serious complications from the sickle cell disease. The mother tells you that she is compliant in giving her daughter the prophylactic penicillin antibiotics that has been prescribed. Temperature is 102, physical exam shows clear rhinorrhea, but is otherwise unremarkable. The most appropriate management of this child is 2. Okay. Well, we talked about sort of the initial management of sickle cell. If you remember, it involves pain meds, it involves antibiotics, it involves hydration, and if the hemoglobin is very low, it can involve transfusions. They don't tell us anything about her hemoglobin level. So let's go through these choices. Observation. Okay, well that doesn't really do any of these, so that's out. Hydration and antipyretics, so something for the fever. Well, that seems pretty good. Number 3 says antibiotics and hydration. Well, that covers 2 of what we have. Increase the dose of prophylactic penicillin. Okay. Send a complete blood count and blood cultures and send her home. Alright, well the best answer for this would be choice 3. And the reason is because this child has sickle cell disease and she presents with a fever. And fever is oftentimes a sign of a infection. So she definitely needs broad spectrum antibiotics. And part of the mainstay of treating somebody with sickle cell disease, especially when they present to the emergency department, is adequate hydration.